Welcome to Ironwood's Lunch and Learn. I am Dr. Aaron Ambrad, radiation oncologist here in our Scottsdale office. Very happy that you could join us for this talk. And today I'm going to be discussing sarcoma and radiation therapy. So first thing is, I always get asked, what is a sarcoma? Sarcoma is essentially a soft tissue or connective tissue cancer, which differs in a lot of ways from a typical cancer, which is usually an epithelial cancer. These cancers are usually treated with surgery, and depending on the stage and presentation, we will often be using radiation. Most of these tumors are not treated with chemotherapy, which is a big difference between sarcomas and epithelial cancers. We always try to determine which type of grade we are dealing with when we're dealing with a sarcoma. Usually we break this down simply between low grade and high grade, and then it always depends on what we do. What we do always depends on where the tumor is located. These tumors can basically be in any part of the body. Most commonly, they're in the extremities or in the trunk. Low-grade tumors that are small are essentially stage 1 tumors, and these are usually treated with surgery only, and we would only use radiation for certain extenuating circumstances. If you have a stage 2 or 3 sarcoma, which is the most common stage of sarcoma, these tumors are most commonly high grade and almost always treated with what we call neoadjuvant radiation. This is giving radiation first before surgery to help get the tumor to shrink some and make surgery easier for the surgeon. This is often done with a 5 to 6 week course of radiation therapy. Here at Ironwood, we like to utilize something called IMRT, which stands for intensity modulated radiation therapy. And this allows us to be very precise with delivering the doses of radiation and minimizing normal tissue toxicities. This is very important for sarcomas, as most patients with these kinds of cancers have very large tumors. The average size sarcoma can approach up to 10 or 15 centimeters in size. So it's very important to use precision radiation to minimize toxicity. Once you've finished a 5-week course of radiation, then you go to surgery, usually about 4 to 6 weeks after you finish radiation. This is then followed up possibly by what we call a post-operative boost, and this depends on the findings of surgery. If you're able to have a complete excision with negative margins, you often don't require any more radiation. It is often common to give a post-operative boost after your surgery. The other reason we would use radiation in sarcomas for patients who have unresectable disease, where their tumors are so advanced that they're not able to undergo surgery. So we will utilize radiation for palliative reasons in that situation, and that often requires higher doses of radiation and in some cases chemotherapy. We can also utilize radiation therapy for the unfortunate patient that has metastatic disease to the lung, for instance. In this case, if the patient's disease is limited, we can use something called stereotactic radiation, which is a very intense form of laser beam type of radiation, which can often help slow progression of disease. So hopefully you have learned something today for our lunch talk. Here at Ironwood, we have several experts who deal with sarcomas, and all of our offices will have someone who can help. And it's very important, if you are diagnosed with a sarcoma, that you have a multidisciplinary approach and you see a surgeon, a radiation oncologist, and a medical oncologist before you actually do any treatments. If you enjoyed this talk and you'd like to see some more content by myself or any of our other colleagues, please click the link below in the description, and have a good day.